So let me go ahead and introduce today Steve Seeley. He is a health insurance advisor with Integrity Health Advisors. He specializes in Medicare insurance, representing many of the top Medicare health insurance carriers in Colorado. Steve's sole focus is on marketing the Medicare maze clear, or making the Medicare maze clear and as straightforward as possible for his clients. Steve's core business value is that the interest of the clients come before his own. As a result, his ethics and client focus have led his business to grow at an extraordinary pace since its inception in 2018. All right.
All right. Thank you, Melissa, and thank you everybody for joining. So we have an hour, right?
Yes.
Or until 1 o'clock anyway. Yeah, so I'd like to talk to you about the changes that are occurring in the Medicare space for 2026 and the reasons why these changes are happening, and then leave most of the time for questions because I'm sure there's a lot. So Medicare changes every year, as you probably know, and as you probably also know or may know, the two main ways that you can get Medicare coverage is through once you get your basic original Medicare, your basic Medicare A and B. So Medicare Part A covers hospital costs and Part B covers medical costs. But those have large exposures for you if you only have A and B, in that there's pretty significant hospital copay or coinsurance of or copay of $1,700. Sorry, deductible of $1,700 approximately every time you go to the hospital. So if you are admitted, you owe $1,700, and then you get discharged, and 3 days later you go back in, then you owe another $1,700. So that's for Part A, and then Part B, that you pay 20% of all medical costs. And so usually people get some sort of supplementary coverage to fill those gaps in basic A and B, and that takes two forms. One is to get a Medicare supplement plan along with a separate Part D drug plan, which covers medical expenses and Part D drug expenses with two separate plans. And there's all sorts of rules around getting Medicare supplement plans, and they charge a premium every month, and you can get different levels of coverage depending on how much you pay per month. But typically, when people start out when they're age 65, they pay maybe $130, $150, $170 a month for the Medicare supplement, and then they pay an additional cost of anywhere from $0 to $150 for the Part D plan. So that's one option you can do. The other option is to get a Medicare Advantage plan, and you do one or the other. You don't do both. So it's kind of like option A or option B. With the I probably shouldn't use A and B in that context, but anyway, the two options. Medicare Advantage plan is very different from a SUP and Part D. Typically, there are many cases there's no premium, at least up till now. That could change in the future, but up to now, many Medicare Advantage plans have no premium. And in exchange for not paying a premium, you pay copays, coinsurances when you get services. And then there's many additional benefits to Advantage plans that are in addition to just covering basic medical costs. With a supplement plan, they just take care of that remaining Part A hospital deductible and Part B coinsurance. That's all they do. They fill the pothole in original Medicare. Whereas Advantage plans do that but they also add extras like coverage for eyeglasses, or in some cases, food cards, or dental coverage. You know, Medicare does not address dental. It does not address vision care. I mean, eyeglasses, things like that. So those are the two options. And that's what I help people understand and do. Like, I help people get original Medicare first. You have to get A and B first before I can help you. And then, so I help people do that. It's just a simple online application process for that. And then once you have your Medicare card with your Medicare number, then I can help you get either the supplement plus Part D or the Advantage plan, which sometimes is also known as Part C. And in most cases, that includes Part D in it. So you only have to get that one plan to get the drug coverage as well. So that's kind of Medicare in a nutshell. And I don't charge for my services because I'm paid by the insurance companies to help people enroll in these Advantage or supplement plans and Part D plans. So let's talk. I'd like to talk a little bit about 2026. There's more change than usual this year. There's a lot of change, and so I'm just going to go through what the different changes are and the background of each of them. But in general, costs are going up for everybody, and coverage is decreasing. And I'll get into the details of that more, but basically there's a number of factors that are playing into this. One is the Inflation Reduction Act introduced a cap of $2,100 in 2026 to Part D coverage for everybody. And so that means that somebody who was on a $100,000 a year drug is no longer going to pay more than $2,100 for that. And so that cost needs to get covered somewhere. And so that is pushing that cost elsewhere in the plans. Another factor is that after the pandemic, the utilization of providers' services greatly increased because people had put off all sorts of elective procedures because of COVID. And then after the pandemic, they went and got all kinds of things done. So the insurers found that there was all kinds of costs related to people getting elective procedures. And so that's a problem for both Advantage plans and supplement plans. Another issue is that there's less money for the Medicare program altogether from CMS, the Centers for Medicare and Medicaid Services. CMS is the arbiter of all of Medicare. CMS is the federal department that runs Medicare, and so they set the rates that they pay the insurance companies, and there's less money this year. And so, you can blame the government, the current government in part for that. And then there's, of course, just simple overall inflationary pressures overall, which we all know too well. So those are some kind of the general broad market influences, and there are others as well, but those are some of the main ones. So now I'd like to address some of the specific changes with Advantage plans, and I'll talk about supplement plans later, but many people have Advantage plans, so I wanted to address those. First of all, there's two types of Advantage plans. So I'm licensed in Colorado. I'm not licensed in Wyoming. And so I'm not really familiar with the Wyoming market, but many of my comments should apply to the Wyoming market, but I can't speak definitively about Wyoming. But in any case, in Colorado, there's two main types of Advantage plans. There's a HMO and a PPO. HMO, Health Maintenance Organization, tends to be is more of a managed care type of model where the insurer has networks of doctors that are contracted with them, and so they control costs of what they're paying the providers by having the doctors in network. And so if you have an HMO, you have to go within the network of the Advantage plan. You cannot go out of network. PPO, Preferred Provider Organization, is different in that you can go out of network, and generally PPO plans, the benefits are not as good, so most people opt for HMO to get the better benefits and just stay within the network. I have an HMO myself to get the better benefits. But if you have a PPO, you can go out of network, but it's more costly. But it's also more costly for the insurer because they have no control over the costs that they're paying. So this year, for the first time in my 8 years, I'm seeing specific companies pulling out of PPO market altogether. So in Colorado, and again, I don't know about Wyoming, but in Colorado, United Healthcare is no longer going to be offering PPO in 2026 at all. It's called a service area reduction. So anybody who has a United Healthcare PPO in Colorado is going to lose that plan. No ifs, ands, or buts, and we'll have to get a new plan for 2026. There are other carriers that I represent, and I represent several like Humana, Aetna, Select Health, Devoted, that some of those carriers still have PPOs, but I wouldn't be surprised to see them go away in the future either because again, because of the cost pressures. But that's a big change. That's thousands of people in Colorado are going to lose their plan and need to get a new plan. So again, that's called a service area reduction. And so that's where people like me as an agent come in and help people figure out what the best option is for 2026. Another important consideration in Colorado is that in 2026, UC Health is no longer going to be in network with the Devoted Health. So anybody who has planned through Devoted Health that sees UC Health doctors will need to change their plan as well. And that's true for PPO, HMO, whatever. That's a significant change for Devoted clients. Another important change in 2026 is that there was a program set up by the federal government years ago called the Value-Based Insurance Design Program, or VBID, that basically supplied the money for people to get food cards, over-the-counter money, utilities money, money for dental work, typically mostly for people who have Medicare and Medicaid. And so people who have Medicare and Medicaid are called dual eligibles. So two Medicare and Medicaid, dual eligible. So dual eligibles we're able to get extra benefits from plans called dual special needs plans. And the VBID program paid for, 100, 200, or even more in grocery money every month, dental coverage of 2,000 or 3,000 a year, eyeglass coverage, etc. And so the VBID program is going away at the end of this year. And there is something that's replacing it to some degree. And that's key, it's to some degree, which is called the SSBCI, the supplemental benefits for the chronically ill, special supplemental benefits for the chronically ill, which will help those same people get most of those benefits. And, a few carriers, notably Devoted, also had a food card, even for non-dual people the last year. People will still be able to get that benefit, but they have to qualify under SSBCI, under the special supplemental benefits for chronically ill. And so there are 17 different conditions that qualify you to get these additional benefits. Things like heart issues or high blood pressure, neurological issues, asthma, all these sort of different chronic conditions. Most people will qualify because we're at the age where we have something or other. So, but not everybody. So that's an important change as well. Now, for supplement plans, they're changing too. Supplement plans, I've seen in the last year, are going up precipitously in terms of their premiums. In many cases, up to 15 to 30% increase in premium, which is a lot. And again, it's due to the same cost pressures that Advantage plans are experiencing. And supplements are even starting to require pre-authorizations in some cases for particular procedures, which is brand new. One reason that people have gotten supplement plans up to now is because it gives you a lot of freedom. You can go to any doctor that takes Medicare in the country. You don't have to work in a network, and there's no pre-authorization process where the doctor has to get pre-authorization for a specific procedure from the insurer. They just do it and get paid. But supplements are starting to require pre-authorizations now too. And then there are big changes in Part D that started this year and are continuing next year. So Part D, again, is the drug plans. So first of all, there was a cap that I already mentioned, introduced by the Inflation Reduction Act. This year it has been $2,000. Next year it's going up to $2,100, where you're not going to pay more than $2,100 for all your medications. And so that, as I mentioned, that pushed costs elsewhere. And so what's happening is that the Part D insurers are introducing things like deductibles where they didn't have deductibles before. So you have to pay the first amount up to $615 a year. So if you have a deductible of $615 on your plan, then you have to pay all of that until your drug plan kicks in at all. So it's up to $615, can be less. And so the carriers are either introducing deductibles where they didn't have them before, or they're increasing them. Uh, Another significant change is that Part D carriers used to pay us agents to represent them and represent their plans. They're no longer doing that. So I'm not able to help people with their Part D plans anymore, which is really sad because Part D can be quite difficult and complicated. But for Part D information and to figure out your Part D, you need to go to the insurance company directly. Now, with the Advantage plan, as I said before, Part D is included in the Advantage plan, so no problem. I can help people who are on an Advantage plan with their Part D. I'm going to keep an eye on the time. So those are the changes for this year, the main changes. So I just want to open up for questions. We've got 35 minutes, so how should we do this? Maybe just put up your hand or just chime in. David, do you have a question?
Yes, I do. Thank you for your information. So I'm a Parkinson's patient. I think most of the people on here are. And the issue of an Advantage plan versus a supplemental plan comes to heart when it deals with going to a movement disorder specialist. I'm not sure if you're a specialist on Parkinson's issues, but
I'm
you're not. But my impression is with movement disorder specialists, there's a waiting list whether you're in an HMO or a PPO or a supplemental plan. So from that perspective, if you're a Parkinson's patient that has special needs or you need a DBS surgery or you need a subcutaneous pump, my assumption is there's not a lot of difference between an Advantage plan and a supplemental plan in terms of seeing a movement disorder specialist quicker or slower because there's a shortage of them. Do you have a comment on that?
Yeah, the short answer is that there's no difference because when it comes to Medicare and insurance, we're talking about the money aspect. We're talking about coverage, and so and yes, I'm not an expert on this. So, but when it comes to getting care. Your insurance isn't going to affect how quickly or slowly you're going to be able to book that appointment. They're two separate things. Does that make sense?
It does. Thank you. Thank you. That's my question.
Yeah. Okay. Margaret.
On out of pocket, if they say you've met your out of pocket for the year, does that include prescriptions?
It does not.
Okay, that seems to be what's happening because I've met my out of pocket, but I still pay those prescriptions.
Yeah. So what Margaret is referring to, you have an Advantage plan, right, Margaret?
Yeah, that's correct.
Yeah. So on Medicare Advantage plans, there's what's called a maximum out of pocket, which is a cap on how much you pay for medical costs in a year.
Right.
And that does not include drugs.
Okay.
Yeah. Juliet. I can't hear you. You're muted.
There, thank you.
Yeah.
My husband has Parkinson's and he just experienced mania and several other mental health issues due to his medications. So he's now in the hospital where they're doing med management, rearrange or do away with meds. Will Medicare cover that hospitalization?
Well, it depends on his coverage, Juliet. So does he have just original Medicare or supplement plan or Advantage plan?
Original Medicare, and then we have insurance. We purchased retiree health insurance supplemental plan, I guess you'd call it.
Oh, I see. Okay. Well, since I don't know the specifics of what you guys have, I can only speak generally.
Okay.
But certainly Medicare and Medicare insurance plans cover hospitalizations in general, yes.
Okay.
I have some questions in the chat when you get a second also.
Okay.
And then does Medicare, he's now gotten to the point of where he does need care. So does Medicare cover any in-home care? You know, with a care or
If it's prescribed, it might be. If it's prescribed, and it's so home health in Medicare space is only covered if it's medical. Like, you know, if you have somebody coming in to clean your house or do your dishes, then or help, you know, help in various ways, then no, it's not covered. But if it's you know, nurse practitioner coming in, then it may be covered. It depends on what your coverage is, though. That's something you need to contact your insurer about.
okay, but when you say insurer, so we have the Medicare A and B, and you're meaning the supplemental insurer?
Yeah, yeah,
Okay.
yeah, and so there's something to understand there that I think is important for all of you. When you have only A and B and nothing else, then you have Medicare. And the insurer is Medicare. And if you have questions about your coverage, then you need to contact Medicare. If you have a supplement plan, and again, Juliet, I don't know what type of plan you have. So, but if it is a supplement plan, then that is secondary to the A and B.
Yes.
Medicare is still primary, and then the supplement is secondary. But the supplement is the one that you can contact and find out how your coverage works.
Okay.
Yeah. If you have an Advantage plan, then the Advantage sits in front of the A and B and is the primary. And so absolutely in all cases, you're going to be working with the insurer because they've literally taken over your coverage from Medicare. Whereas when you have a supplement, the insurer is working with Medicare, but they haven't taken it over. But when you have an Advantage plan, Medicare or CMS is paying the insurance company to take over your coverage. And so you're absolutely dealing with the insurance company in that case. I see two hands up, so I'll take those, and then we'll go to the chat questions. Marie?
Hi, thank you for taking my question. I don't know if it's too personal and not specific, but I retired during the pandemic and I wasn't able to access my retirement sessions where they teach you how to sign up for your own retirement. So I took out United Healthcare AARP for 1 year. Then when the premium went up, which of course it did, I went back to get my subsidy under my PARA, Public Employee Retirement Association. But because I did that 1 year, and then my husband retired 11 months later, and he's the person with Parkinson's. But because I did that, I understood that I got a bill from Medicare and I got a bill from ARP, that my secondary. Now that my PARA has taken over my retirement company, and my husband has a similar plan, but we voted for a different level. And it feels to me like they're not paying any more than just the Medicare. And like 2026 for everybody else, mine went up 5 times the amount I was paying the last 2 years. I mean, 5 times. And unlike this year, I was not prepared for it. I didn't read all the details. I thought I knew it really well in 20 and 21. So I kind of skipped it and didn't do it. And I paid, I'm sorry for that because it was very, very expensive. So now I'm looking carefully. But that was my one observation. They're taking over it and CMS is paying them to take over it, but I don't see them covering like United Healthcare under AARP. And I don't know if that's just because it's billed differently and what your thought about that is.
All right. So let me clarify something. So you right now and your husband both are currently under para?
Right.
Okay.
Yeah.
All right.
We are. And he's on one, like one of us is on one, like one or
Yeah.
two. I don't know if it's A and B or one
Yeah,
or two,
yeah,
but
yeah. That's fine.
he's got a higher deductible than I do.
Yeah. So para is changing a lot in terms of its costs and coverage. It used to be that it was a slam dunk that if you had para, that was the best way to go.
Yeah,
It's
I'm starting to doubt that, but
well, you and everybody else really, because I've just been talking to clients just the last couple of days where the minimum cost now is $80 premium or more, depending on years of service, and then the plan isn't that great anyway. So it's no longer a slam dunk to stay with para, and so I think you could benefit from a conversation with me to compare what you could get in the open market compared to your para. I'm coming to this conclusion literally in the last couple of days myself with clients with para. So that's kind of the short answer. If you have specific questions about your current coverage, you need to contact para. They're the insurer.
Yes. So is Parkinson's one of the 17 conditions under the SSBCI?
It would qualify. Yeah.
Okay, perfect. What do you suggest for a
And
young?
just sorry,
Oh,
just to add a little more on that.
Yep.
Neurological conditions qualify, so it would qualify under that.
Perfect.
Yeah.
Thank you. Another one was, what do you suggest for a young onset patient, age 54? Do you recommend starting by applying for Medicare disability and then see, what happens, or, sorry, I had something pop up on my screen.
That's okay. I can answer the question.
Okay.
You need to apply for Social Security disability first. And then once you get Social Security disability, you have to wait 24 months before you can get Medicare.
Okay. Kathy, did that answer? I hope so. We can come back if not. They would like me to post your information. Are you okay with that if I put it in the chat?
Yes.
Okay. So somebody wanted you to clarify UC Health change. So I'm thinking with the devoted health and UC Health.
Okay. It's just that UC Health is no longer going to be in network with Devoted. And also, UC Health will not bill Devoted clients either. So whether you have a Devoted HMO or even if you have a Devoted PPO, you cannot go out of network to UC Health. That's an internal change that UC Health made because they have a partnership with another insurer called Select Health, and they wanted to build a closer relationship with that particular insurer, which Select Health is owned by Intermountain Health, and so UC Health decided to narrow the provider networks that they take, and so they are no longer going to take Devoted patients nor Cigna.
Thank you.
Yeah.
The next question is, does the Part B deductible only apply to Advantage plans?
Part B is in boy?
D, or
Oh.
yes, Part B. No, yeah, Part B.
Part B is in boy. No, the Part B, there's no Part B deductible in Advantage plans. That doesn't apply. There is a Part B deductible to many supplement plans. And to, of course, to original Medicare, to Part B itself, which this year in 2025 is $257 a year. And next year, of course, it'll go up another $20 or something.
Thank you.
Mhm.
The next question is, I've been told that because I have Parkinson's, I cannot change my supplemental insurance. Is that true?
Very likely, that's true, yeah. Because you know, with supplements, if you want to change, you need to go through underwriting, which is health questions, and most insurers will not change taking on someone who has been diagnosed with Parkinson's. Or, I mean, there's different rules for the different companies. You know, in some cases they may take you on, but the rate could be double. Like there's level 1 rate, which is the basic rate, and then level 2 is, you know, essentially double. But again, all the companies are different and they all have the different rules. I can't answer that question super specifically because they're all different. But generally speaking, that's probably the case.
Thank you for answering that.
Mm-hmm.
The next one is TRICARE for life affected by this?
No. That's the short answer.
Perfect.
Yeah, TRICARE is completely separate. Yeah, so there's not much to say about that.
The next question is back to this. Can you confirm that UC Health is no longer accepting Cigna? Is that for either Advantage or supplemental?
For Advantage,
For Advantage.
yeah.
Okay. All right. And then do you know what the Medicare premium will be for 2026?
I do not. That has not been released yet, but I believe, and so this person is asking about the Part B premium. Part A has no premium. Part B has a premium. This year it's $185. I've heard around $20 increase.
I've heard it's 206.
David, you said 206? Is that right?
That's what,
Say that again?
You said you heard it was 206?
Yeah, Part B is 206 for 2026.
Yeah, so $21.
somebody or this person was told that Cigna is changing their supplemental plans with the new name. Is that true?
I have no idea. I do not represent Cigna, so I don't know.
The next one is for someone with Parkinson's, what plans would you recommend for consideration? Also in supplemental better is, it also is supplemental better than HMO?
Well, so that's not a question that can be answered generally. It really depends on your situation and your medications, your providers, your situation altogether. It takes a more kind of careful analysis than that. Also, your financial situation. I mean, many people can't afford a supplement, so they get Advantage, you know. So.
Perfect. That is all the chat questions I have. Did anybody else have any other questions?
I see Juliet's hand up. David, go ahead.
I should have said lower my hand. I'm sorry.
Okay. David has a question.
Yeah, so I've decided to go with Kaiser Silver Plan. I did a lot of research. Do you have any experience with that?
Well, I mean, Kaiser is very different. Kaiser is a captive provider situation where you only see Kaiser doctors, and I represented them for a year or two, but I dropped representing them because I was finding that, I'm in Longmont, so many of my clients are up north, although I do represent all of Colorado. But I was finding many of my clients were having to travel long distances to see specialists. So having to travel to Denver or wherever because the specialist they needed to see was only in Lakewood or something, so it was pretty inconvenient. And also the service provided by Kaiser altogether seemed to slip a bit in the last few years, but I don't know. I mean, I can't say that definitively, but that's pretty much, it's just really different. You're in the Kaiser system, and some people love it. Some people are very happy with it, and
Kaiser goes on strike frequently, and right now they are on strike in a lot of states, but not in Colorado. I've had them in the past. They treat older patients terrible.
My experience has been the opposite. I've had a good experience with them.
yeah, and I think it's very individual. I think in many cases people do have good experience with Kaiser. I mean, I don't have anything negative to say about them. It's just a different approach than than the way I generally represent people. And I hope you have a great experience.
Thank you.
Yeah.
So we have another question here. Is Mutual of Omaha Plan G a good supplement plan to Medicare, or do you represent them?
Yeah, I'm not contracted with Mutual. There's literally dozens of supplement insurers, carriers that I just, I go with the majors. I'm sure Mutual is fine. I mean, one thing about supplement plans is that they're very hands-off. So once you have a supplement plan, you just go to the doctor, and whether you have a Plan G from Mutual or from Aetna or Humana or ARP or whoever, it works pretty much the same. I mean, some of them have little bells and whistles, but the basic coverage is the same no matter which carrier you've gone with. So it's probably fine. And another comment in relation to that is that the main differentiator between the different supplement plans, so let's say you're shopping for a Plan G, the main differentiator is cost. And they can vary wildly. You're getting the exact same coverage, but Plan X might be charging $170 for Plan G, and Plan Y might be charging $300. So it pays to shop around for supplements. And so typically when I'm helping a client get a supplement plan, I'll just have a look at who's offering the best price and go with that.
When somebody's looking for an individual like you that specializes in Medicare and finding a supplemental, what is the best way of finding somebody in their local area, or that would be able to help them through this process. Is there a way?
Uh, well, if they're in Colorado, they just contact me, but
Right.
but if they're not in Colorado, no, it's a matter of going to Dr. Google, you know.
Okay.
Well,
I'm
wait a
just
minute. Sorry.
wondering
No,
'cause-
no, I take that back. Sorry.
That's okay.
No, my team. I have a team that, you know, there's 40 odd agents in Integrity Health Advisors, and even though I'm licensed in about 5 states, but like Colorado, New Mexico, Washington, but my colleagues are licensed in virtually all the states. So they could contact me and I could refer them to somebody in the Integrity Health Advisors stable
Okay.
that is licensed in their state. And we're all good.
This one might. So this individual lives in the middle of nowhere, and they have Para United Healthcare Advantage PPO. What do you recommend for them?
Well, this refers back to the conversation I was having earlier with the person with para, which is that, first of all, you need to get your information about your plan from para, but it's questionable whether that plan is good for you in 2026 and beyond. And so that's just a conversation I would have to have with them. I hope they heard that earlier conversation about para, because we went
Yeah.
into some detail about it. So, you know, para's not, you know, para's changed a lot since I started. Yeah.
Yeah. I think at this point, a lot of them are getting into wanting to know about specific companies, and what your experience is with them. I think at this point, if they have specific questions, they should reach out to you.
Yeah. Yeah, they could email me with specific questions. This is my busy season, so I'm very booked up. So like if there's a specific question, probably best to email me and then I can respond that way. But I also can, you know, I asked Melissa to send an appointment, like a calendar link to you if you want to book an appointment. That's possible as well.
Well, Steve, thank you so much for coming on today and doing this webinar for us and giving us the changes that are happening. Unfortunately, you know, it changes every year and goes up in price, but this is a great resource for everybody. Steve is. So if you have questions or anything, I have put the link or his information in the chat. I will also email it out in a follow-up email that will be sent out tomorrow. So you can book an appointment with him or send him an email to get assistance. If you have questions, you always can reach out to the PAR office, and I hope you all have a great rest of your day.
Thank you. Thank you for inviting me. Good to
Thank
see
you
all.
very much.
Okay. Bye-bye.
Bye.